The broadcast is now starting. All attendees are in listen-only mode.
Welcome, and thank you for joining the Get Involved from Coverage to Care webinar. We'll be starting shortly, but we have a few logistics reminders that we wanted to share. First, the audio lines have been muted to minimize some of the background noise. If you have a question, we would like you to please use the question feature that's on the right side of your screen. You may ask a question at any time, and we'll collect them and answer them during the Q&A period. If you're experiencing any technical difficulties, you may also use the question function to request help from us. Finally, at the end of the presentation, we really would like you to take a feedback form, if you would. We really value your input and feedback, and we use that to improve future webinars and programming. You can also share questions and comments in the chat window on the right side of your screen. And we have closed captioning during this presentation. You can access real-time transcription at the link shown on your screen. If you have any technical questions, please call 855-352-9002. With that said, I'm delighted to introduce some of our speakers here today. Dr. Kara James, who is the Director of the Center for Medicare and Medicaid Services, Office of Minority Health. Ashley Petticord Austin, who is the Health Insurance Specialist at the CMS Office of Minority Health. And I am Monique LaRocque. I'll be helping to moderate the session today. In addition, we have an esteemed guest speaker, Jenny Sullivan. She is the Director of Best Practices Institute at Enroll America. During our session today, we'll go through the open enrollment season and some toolkit materials that will be beneficial for your community. We'll give an overview of the From Coverage to Care campaign. We'll talk about partnership and how to get involved. And we'll do some ideas exchange and Q&A. With that said, I'd like to introduce Dr. Kara James.
Thank you, Monique, and good afternoon to all of you. Thank you so much for spending a little bit of time with us today as we talk about From Coverage to Care and what we can do to continue the progress we've made. So, as we all know, we have millions of individuals who have been able to obtain coverage, and the uninsured rate in our country is at the lowest point that it's ever been. But we still have work to do as we're gearing up for the 2017 open enrollment period to continue our outreach efforts to reach those individuals who still need coverage. And as we transition out of that, making sure that those who have been able to sign up for coverage are able to use it to get the care that they need. And that's what From Coverage to Care does. So as we mentioned, we're going to talk about the Enrollment Toolkit and how we can leverage that to reach those individuals who still need coverage, and then some of the resources that we have to help them connect to primary care and preventive services. So thank you for all of your work that you've been doing throughout the year and the work that you continue to do in helping us move individuals from coverage to care. So as we gear up for Open Enrollment 2017, I just want to remind people that it starts on November 1st of this year and will continue until January 31st of 2017. And as always, there are 4 ways through which individuals can apply for coverage. We have the call center, which is 800-318-2596, in which we have representatives as well as support available in more than 150 languages. Again, people can apply online. You can use healthcare.gov or cuidadodesalud.gov. We have more resources and tools such as to see a plan and compare prices and others to help individuals select the plan that best meets their needs. And we continue to have in-person assistance through localhelp.healthcare.gov or through the call center. So as we get closer to November 1st and the work we have ahead of us, wanted to take a moment to talk about our enrollment toolkit that we are updating to share with you. So thank you again and good luck, and I'm going to turn it over to Ashley to go through our enrollment toolkit.
Thanks, Kara. So after we talk about open enrollment, we just go through the toolkit to help remind us of some of the most important pieces to consider, in particular when it comes to health insurance literacy. We often hear from consumers, community groups, and researchers that consumers have a hard time affording their plan and actually using it. Sometimes this can be resolved and at least helped by choosing a different plan. So to help this, we created the Enrollment Toolkit. Each section includes questions the consumer may have, key messages to relay, and additional resources on the topic. You'll find a few cost examples to help explain key messages and important insurance terms like copayment, coinsurance, deductible, and a network provider. Today we'll go over each section, and I'd also like to highlight that our toolkit has been updated with current figures, so you can use it for Open Enrollment 2017. And you will be able to download this from our website, and we'll explain how to go to the site shortly. So some consumers may not be convinced that they actually need coverage. You may need to begin here with why they need to sign up and the benefits they will gain by having it. Coverage is security. Coverage can relieve some of the stress about getting sick. This is an opportunity to personalize your conversation depending on your consumer. If it's a person with a chronic disease, explain that coverage will help them manage their disease. For younger adults, remind them of the options they have: the marketplace, catastrophic coverage, or a parent's plan. Coverage also pays for preventative care. Explain that screenings and test results can help monitor health and make sure your person is on the right track. And importantly, many preventive services are available at no cost to the enrollee, meaning no copayment or no deductible. Coverage may be more affordable than the person thinks. Many people are not aware that 8 out of 10 people enrolling in coverage through the marketplace do qualify for financial assistance. So some resources to help you include information on income and the marketplace, as well as the exemption and shared responsibility payment. And those resources are included in the Enrollment Toolkit. So many consumers aren't clear about what they're getting when they sign up for coverage. This section covers some of the key features and financial assistance available to most consumers that are enrolling in coverage through the marketplace. So remind consumers that all marketplace plans must cover the 10 essential health benefits. And this section does walk you through those. This section also introduces key insurance terms. Consumers may not understand the difference between deductible, premium, copay, and coinsurance. So this part of the toolkit helps explain those terms and the differences so they can be considered and compared when choosing a plan. And again, many people don't think they can afford coverage and don't know that assistance is available, or many others assume that they just don't even qualify. But always encourage someone to apply to determine their eligibility, just to make sure to see if help is available. In the toolkit, we have what we call a cheat sheet, and this is for financial assistance to quickly visualize what someone might be eligible for. And this is one of the main pieces that we updated this year with current figures. Explain that the premium tax credit is for people with household incomes between 100 to 400% of federal poverty level who are not eligible for certain other coverage. Lower incomes are eligible for a larger credit. This credit reduces monthly premium payments. Consumers can apply it before they pay their premium, so they pay less each month, or when they file their taxes and get the money back at the end of the year. Or there's cost sharing reductions, which can provide additional financial assistance for those consumers eligible with incomes between 100 and 250% of the federal poverty level, and also who also qualify for premium tax credits. So consumers know this is an extra reduction that lowers the amount they would pay for out-of-pocket expenses. So the copays, the coinsurance, the deductible, but they must enroll in a silver plan. We'll take a little time to go over some of the key words from this section, because these are pieces that we want to make sure a consumer can understand. Premiums are payments generally made each month to an insurance company. Premiums are usually the first cost consideration a consumer will look at. But be sure consumers know that this cost is required each month, regardless of whether they used healthcare services. That's an important piece that some consumers aren't aware of if they aren't familiar with insurance. But that does ensure that the coverage is free of any lapse or problems. A deductible is the dollar amount that consumer will have to pay for health services before their plan will start paying for their care. The deductible may not apply to all healthcare services. For example, in marketplace plans, coverage for free preventative services is not subject to the deductible. Other plans may not have a deductible for primary care or even prescription drugs. Different plans have different deductibles for particular services, so look through insurance information to see what a person can expect. Talk with consumers about whether the cost is affordable, if they will be able to pay down that deductible, and discuss any trade-offs that a high deductible may have with a lower premium, and vice versa. A copay, or copayment, is a fixed amount the person will pay for a covered service or supply. Copays are usually a set amount, so maybe $15 for primary care, or for a specialist, it might be $35. The amount of the copay will differ depending on the type of care. As another example, brand name drugs will have a different copayment than generic. Some services won't have a copay, again, such as preventative services. Coinsurance is the consumer's share of the cost of covered healthcare service. It's different from a copayment because it's a percent of the total allowed amount, not a set dollar amount. So as an example, if the cost of a visit to a specialist is $100 and the consumer has a 20% coinsurance, he or she would pay $20. So use these examples to help explain the difference between copay and coinsurance. The next section is what consumers should know before enrolling in a plan, and it was designed to help consumers choose a plan that best meets their needs. So start out by explaining the difference between the plan levels, bronze, silver, gold, and platinum. You should help consumers understand it's not just a difference in the monthly premium payment, but that generally there's a trade-off between premiums and costs. Lower premiums usually come with higher out-of-pocket costs. The consumer's preference and plan for using those services will help to dictate which one works best. So talk with consumers about their preference for paying a little each month or to pay less when they use their coverage. This section will also cover provider networks. It's important for consumers to know the difference between in and out of network costs. The number and availability of providers in their network is important to know. So show them how to check the availability of their favorite provider using either the plan's website or simply by calling their provider's office. Prescription drugs are another important part of health insurance coverage. So be sure to bring this up with consumers, especially if they already take multiple medications. Ask consumers about any current medications and look for those specific costs to determine what their monthly prescription cost would be. Finally, it's important to make the consumer aware that any dental and vision may not be covered. So if the plan they choose does not cover these services, but the consumer desires them, talk with them about standalone plans or other plans that might include more services. And the resources in this section link to more information on the metal levels, the differences, finding providers, and helping to explain coverage. So here in this section, you also find a few key terms that we cover. These are terms that consumers may not know, so you might want to review these. Networks are important when choosing a plan, as we said, and they need to be understood when someone actually starts using the coverage. Explain to consumers that an insurance company has a contract with certain doctors, facilities, and suppliers to provide covered services. This means these doctors have signed up with the insurance to accept or take that plan. Tell consumers they can contact an insurance company to find out which providers are in-network or use the website to search for doctors. If you have a doctor or pharmacy you want to use, call them and ask if they take the insurance. Understanding who is in-network is important because it could save the consumer money, and all they have to do is ask. Just ask before the appointment. This is a step to think about before enrolling, but it will be necessary afterwards as well. Consumers might ask about other terms for networks, and network provider may also be called preferred provider or participating provider. If a provider is out of network, it means it might cost more to see them. So tell consumers they can still make an appointment, but to find out upfront how much it will cost and what they will pay out of pocket. The next one is formulary. So a plan's formulary, or a list of prescription drugs that are covered by the plan. Ask consumers if they're currently taking any prescription drugs. These costs will influence which plan they choose. Consumers, especially those with a chronic condition, need to understand how much they'll be paying. Help consumers see how much their drugs will cost by showing them how to find and read a plan formulary. Consumers with Medicaid and CHIP generally have to pay some money for prescription drugs, but it's not a lot. Marketplace plan formularies are posted on healthcare.gov, and consumers can see lists of covered drugs as they compare the plans. Some drugs cost more than others. Formularies are divided into categories, or tiers. The term tiers is important to talk about, since this will tell you the cost for the prescription. These may be more familiar. Generics, often the lowest cost. preferred brands, non-preferred brands, and specialty drugs, and those are, of course, often the highest cost. Consumers can check their current prescriptions to get an idea of what their actual cost would be. And finally, the metal tiers that we discussed. So the plans sold in the marketplace are divided into 4 categories: bronze, silver, gold, and platinum. And the main difference between these is the proportion of consumers' health care costs that the plan will pay. Another difference is how much cost sharing the consumer will be responsible for. In general, there is a trade-off between premiums and costs at the time of care. Lower premiums usually come with higher out-of-pocket costs. To make sure a consumer understands this, consumers should also be aware that no matter which category they choose, all plans will cover the 10 essential health benefits. Finally, we have information about special circumstances. This section includes information specific to the American Indian and Alaska Native population, how to get help for in-language assistance, and it addresses many questions that we have regarding immigrants and their eligibility for financial assistance from the marketplace. There are also a number of resources to link you to others with information for other populations. That includes people with disabilities, those with HIV or AIDS, as well as LGBT populations, and some tools for faith-based and community groups. So as you know, once someone is enrolled, there is still more to do. Encourage consumers to confirm their coverage, either by logging into healthcare.gov or contacting the call center, or make sure that they receive their insurance card. It's also important to make sure they begin to pay their monthly premium and continue to pay that monthly premium if they have one. Once the enrollment is finalized, encourage consumers to review and keep their plan materials so they know what their costs are, what is covered, or at least where to find that information. This section also connects you back to our roadmap to help consumers find a provider and begin regular care. Relatedly, it's important to remind consumers to keep up with their prescriptions or any current treatments that they may have. Resources are available on how to contact plans, how to appeal a claims decision, or even on coverage outside of the open enrollment period. So now that we've focused on open enrollment, we want to turn back to our broader coverage to care focus and highlight some key pieces of our roadmap, especially those that we'd like to incorporate in our upcoming outreach and education efforts, keeping that open enrollment date in mind, and when assisting consumers during this time period. So as many of you may already know, Coverage to Care aims to help individuals understand their health coverage and connect to primary care and preventative services that are right for them so they can live a long and healthy life. We just reviewed the Enrollment Toolkit, but there are other Coverage to Care resources available in multiple languages to help patients on their journey from coverage to care. And that includes, of course, our signature piece, the Roadmap to Better Care and a Healthier You. We'll discuss it in a minute, but also our 5 ways to make the most of your health coverage, a shorter piece which highlights the 5 most important pieces once you're enrolled. And then, of course, we have videos, our STEP booklets, and we have new prevention resources and some partner tools. So the Roadmap to Better Care and a Healthier You explains what health coverage is and how to use it to receive your primary care and preventative services. So the Roadmap is also broken out into a number of other tools. It has the poster, consumer tools that are listed there on the screen, sample insurance cards, a sample EOB to help explain what those mean, and pull-out step booklets. The Roadmap is available in 8 languages. We also offer a tribal version and a customizable version so that you can add in your own contact information or other local resources. Pictured here is the actual roadmap. As you can see, it lays out a path for consumers to connect to care, starting with step 1, put your health first, walking a person through understanding their health coverage in step 2, knowing where to go in step 3, choosing a provider in step 4, and then making an appointment and being prepared for it, followed by step 7, where a person should decide if the provider was right for them, and finally ending with step 8, next steps after your appointment. Each step can be its own lesson. The roadmap is structured so you can take it in pieces or as a whole, walking through one step at a time or taking the journey all at once. So today we'll just highlight a couple steps, 1 and 2, because these are particularly important during open enrollment. The first step in our roadmap, and it's the first step to a better care and a healthier you, is to putting personal health first. Many people think about health insurance as something to be used only when they get sick, but consumers should be using their coverage to stay healthy. Regular care and healthy habits will help people live a long and healthy life. So encourage consumers to receive the preventive services that are right for them. As a result of the Affordable Care Act, we've already said many of these services are available with a $0 copay. It's important to remind consumers of this. Consumers can talk with their health provider about which services are right for them. And we always remind people that it's easier to live a healthy lifestyle when friends or family are doing the same thing. So encourage consumers to talk with family and friends about staying healthy, receiving preventive services, and what they do to live a healthy life. We also talk about 4 parts of putting your personal health first: physical activity, healthy eating, managing stress, and taking an active role in your health care. Coverage to Care has a number of prevention resources that are available for you to share with consumers and to highlight these messages and what preventative services are available. So share these with consumers to remind them of the importance of staying healthy and utilizing their coverage even if they feel well and receiving free preventative services. Step 2 is to understand the health coverage. Consumers won't need to know every detail, but it's good if they can understand what services are covered, how much they can expect to pay if they do get care. Most importantly, consumers will need to know where to find this information when they need it. So we've already reviewed some of the most important key terms from this section when we discussed the Enrollment Toolkit. These are important pieces to understand when choosing a plan, but also when once enrolled, so consumers can make the most of their health coverage. Consumers should become familiar with terms like premium and copay. The back of the roadmap has a list of health terms and what they mean. Consumers can use this to remember the differences between copay, premium, and deductible. The insurance provider and the insurance card can also help consumers understand the exact cost of their premium, copay, and deductible. Pictured here are cost tables. These are included in the roadmap under Step 2. They are examples of what a consumer might pay. These are just examples, but they're real-life scenarios. And it'll help you give a picture and a visualization of what we're talking about. So the first part in green shows all the costs for your service. You can see on the having a baby, for example, it includes the hospital stay, tests, vaccines, and more, and then it provides a total. Likewise, the diabetes example shows prescription costs, equipment costs, office visits, and tests, and then a total. Then each shows what a consumer would pay, then shows the deductible, a copay or maybe coinsurance, depending on the plan, and then the total that the person would actually pay out of pocket. This will help visualize the difference between copay and deductible and actual cost. So this slide shows our sample insurance card and what it could potentially look like. You can actually have this information on its own handout from Coverage to Care, or you can find it in Step 2 of the roadmap. So we've highlighted a few key terms. As you discuss insurance cards and personal information, this is a good time to remind consumers not to share their information with anyone and to keep it in a secure spot. Many consumers have an insurance card at this point, or maybe they even have it on them. If not, their insurance plan should be able to provide this information until they receive the card. This is a good time to interact with consumers and personalize the conversation. Also, to test their knowledge. Have them actually take out their card, find their name, the plan information, the member number, and plan type. See if they can see where it says the amount for their copay or maybe for a prescription cost. Have them turn the card over, explaining that this is usually where the plan's contact information is located. And if they have questions about coverage or a claim, tell them to call that number for help. We'll now turn our focus on how to use these messages and then hear from our partners. So to frame our mindset, let's recap how to use C2C resources. First, we want to start a conversation with consumers. Use the roadmap to decide if a person needs help with Step 1, preventive services, and why they should put their health first, or if they should dig right into Step 4 and find a provider. You may only be able to use pieces of the roadmap at once, or spread the steps out over several interactions or several events. Refer to the roadmap and provide a copy of it to consumers so they can refer back to it. It has a lot of information, and you can help walk them through it. And of course, personalize it. We just mentioned one way to personalize by covering the most needed steps, but you know your community. How else can you make the message best resonate? This could be the way the information is provided, or by slightly tweaking the language. Perhaps adding local resources or your own contact information would be useful. You can use our customizable PDF for that. But you know your community, so adapt the resources to fit them. One of the new resources we think you'll be most interested in is our Partner Toolkit. It's pictured on the screen, and it is web-based, and it's available on our new website as a PDF. The idea behind creating this was to try and make it a little bit easier for you, our community partners, to use Coverage to Care. So any community organization can use this toolkit. All our partnerships are informal, and the participation will vary from partner to partner. Some community organizations will use Coverage to Care in a very minor way, and others will have a heavy health literacy focus and incorporate C2C much more widely. We hope the toolkit will be useful for all groups. It was designed to make your job a little easier by providing pre-made materials and language. But it's up to you what you want to use and how much to use it. The toolkit starts with information about C2C to offer a little background just for your own knowledge, and then we go into ways you can collaborate. It lists available resources in all the languages that we have. And then we provide ideas on how you can spread the word. So it's your time to add to the momentum. This is where we have sample materials in English and in Spanish that you can borrow and make your own. So we have a blog post, a blurb for a newsletter or email list, and we have social media. The social media includes not only the posts, but also graphics in English or in Spanish so that we can reach a wider network of consumers and partners. So again, this is language that is already written and cleared through CMS, and the work has already been done. So there are lots of ways to get involved in C2C. We have the resources, the roadmap, the 5 ways to make the most of your health coverage, our Partner Toolkit, and we also have a community presentation. The community presentation is, again, already written with slides and a prepared script for you to take it and use, whether it's for a webinar, an enrollment fair, maybe a provider open house, or another event. Remember, C2C resources are available at no cost to your organization. So you can download them from our website, or you can order print copies and have them shipped to you. We try to make our resources available online and in the warehouse. So we have resources available in additional languages other than English or Spanish. The 2 on the screen, the 5 ways to make the most of your health coverage and the roadmap, are available in English, Spanish, Arabic, Chinese, Haitian Creole, Korean, Russian, and Vietnamese. And for those with a Native American or Alaska Native population, we also have a tribal version of the roadmap, which gives some information specific to those populations. And of course, again, we do have a customizable version of the roadmap on our website, and that means that you can add in your contact information or a local navigator or other resource so that you can customize it and personalize it for your consumer. So everything is on our website, or you can go to the CMS product ordering website to order the paper publications. Again, it's no charge to your organization for any of the publications, and they ship, again, at no charge. So this is a screenshot of that website, and it's productordering.cms.hhs.gov. And this is the same site for all CMS publications. So if you've ordered the Medicare and You Handbook or Marketplace materials, this is the same site. And again, they're all free. If you have any problems or any questions about setting up an account, anyone can set up an account. But if you have any questions about it, do email us at Coverage to Care, and I'll give you that email address in just a second. So we want to hear what you're doing. We want to hear your stories or your videos, what's worked well, what hasn't, or if you have questions about being a partner, using our resources, or you have any issues with the product order website, please email us. It's coverage2care@cms.hhs.gov, coverage2care@cms.hhs.gov. And we do love to hear stories about what people are doing, because then we can help share them with our partners on webinars like this or by email and other times where we need to give examples. It's great to hear from our partners. So at this point, I will now turn our webinar over to Ms. Jenny Sullivan, who is the Director of Best Practices Institute with Enroll America.
Great, thanks so much. Can everybody hear me?
Yes, we can.
Okay, perfect. It's always good to check. Thanks so much for having me here this afternoon. It is always a pleasure to work alongside colleagues working on the Coverage to Care initiative. I know it has been an integral part of ensuring that consumers can do more when they enroll than just look at a health insurance card. That is obviously critical to ensuring that, that enrollment is a success. Today I just wanted to very briefly highlight some of the resources and research we have done on health insurance literacy and make sure that folks on the call or on the webinar are aware of those and know how to access them. So we can go ahead and move to the next slide, or maybe I can actually change it. I don't think so. So we can go ahead and move to the next slide, which really just talks about sort of our framework around health insurance literacy and what consumers need to know. We at Enroll America have always been focused on the enrollment step, clearly. That is our first and foremost mission. But after the first enrollment period, we really started to hear more from partners about the critical need to really continue to carry the torch through the experience of having and using coverage for consumers. And so we talked with partners and really identify these sort of 6 things that ideally a well-positioned consumer would know if they're going to use their coverage appropriately. They obviously need to know what health insurance is and why it matters and how to get covered, but they also need to know about some of the other critical elements that folks have heard about this afternoon, like financial help, like how to choose a plan, and then essentially how to use health insurance and how to keep their coverage from year to year, whether that's re-enrolling in a marketplace plan, understanding the life changes that might require you to change to other forms of coverage, and so forth. But the bottom line is, when we think about all of this, health insurance is really complex, and the most important thing for consumers to know is not to internalize all of the ins and outs of how insurance works. It's really to know where to go when you get stuck. Where do you go to find help? And that is where Enroll America has really positioned ourselves as a hub to help consumers find local help. And we have a Find Local Help tool that actually, with our Get Covered Connector tool, so that consumers can look online by zip code, find an assister in their community, and even in many cases schedule an appointment right then and there that helps connect them to coverage in their community. It's not just a suggestion, it's a requirement that assisters are carrying consumers through after the enrollment process and really helping them engage and use their coverage. And so we are pleased to be of help as we help connect consumers to that help year-round. And moving to the next slide, and I just have 3, so we're almost halfway through. Wanted to share just some lessons that we have learned through some research that we did between the 2nd and 3rd open enrollment periods, so really last spring. We did a consumer survey, and we found that almost half of the uninsured lack confidence in choosing a health insurance plan, not necessarily surprising, and 2/3 of the uninsured want more information about health insurance and how it works. We also talked with folks who were enrolled in marketplace coverage and found that 9 out of 10, these are folks who had already successfully completed the enrollment process, had a plan, but 90% of them said that they wanted more information about how to use their coverage. So clearly their information gaps are there, and we should not assume that simply by enrolling somebody they are poised to use their coverage well. But what we learned through this research and through talking with partners about it and really doing some qualitative research was that there isn't a one-size-fits-all solution to the health insurance literacy conundrum, if you want to call it that. It's really about designing personalized, individualized approaches to serving your communities, which I think is something that assisters are very well positioned to do and very accustomed to doing at this point. But we really developed sort of this 5-point framework. They aren't numbered, but you'll see the 5 boxes on the screen to really design a health insurance literacy approach that works for you and your community. Starting by, of course, knowing the population you're serving, what are their needs, learning what enrollees value, meeting consumers where they are in the process. Some people have no experience, have very specific needs. Perhaps they have a chronic condition, or they have historically gotten their one prescription drug through some other safety net program where they're used to using sort of other safety net providers in their community, but they haven't used it in the context of having health insurance. And then others that maybe are just moving from employer coverage to marketplace coverage and are more savvy. But really understanding where consumers are and meeting them where they are is critical. Sharing information in plain language is not enough. I think we have seen the utility of plain language glossaries and descriptions and background information to really arm consumers with the details and the answers to their questions when they have them, but that isn't enough. It's really an engagement process and a learning process, and that is where that sort of in-person element is absolutely critical to making sure that consumers feel supported as they're learning how to use their coverage, or as they go off and try to use it and hit bumps, and then they know where to go to get help. Excuse me. And then finally, we have found in anything we do related to enrollment and retention, partnerships are absolutely critical. Excuse me. We have found that that issuers, health insurance issuers and assisters are the two top messengers, whether you're talking about the uninsured and who they want to hear from, as well as those who already have coverage but want to learn more about how to use it and you know, who they want to hear from, and that's issuers and assisters. So finally, just wanted to highlight a couple of resources that we have that are available to folks. You can go to our website and you can navigate to it directly from the home pages, but enrollamerica.org/HIL for health insurance literacy, of course, and you'll find there our health insurance literacy resource hub. This is a regularly updated resource hub with sort of a clearinghouse of health insurance literacy related materials. There's nearly 100 resources on the hub right now, and we update it regularly. If you have resources of your own that you would like to share with the broader community, we definitely welcome those. You can send them to me, and we will get them posted. But what this does is just allow people to sort by topic, including choosing a plan and using coverage, and really look at the resources that are available, primarily consumer-facing resources. Many of these are available in other languages. You can sort by availability in languages other than English. You can, look at videos and things. There's obviously lots of different ways to design sort of a right-sized health insurance literacy strategy for you and your organization. And I think you'll find a lot of really invaluable things if you sort of look through these resources. You can probably find some of the things that you're looking for. And of course, Coverage to Care's materials are posted here, and we look forward to featuring some of the new and updated resources as well. The very last thing I will say is that Enroll America, after the first open enrollment period and hearing from partners, we created a health insurance literacy listserv. It is a pretty active community that, again, shares resources. That's part of how we get our leads for things to post on the resource hub. But it's also a place for discussion and dialogue around what's working, what's needed, and sort of a problem-solving community around this issue. So if you are interested in joining that listserv, you can also contact me, and we'd be happy to add you. It's jsullivan@enrollamerica.org. And with that, I will turn it back over to Ashley. Thank you.
Thank you so much. If you have any questions about any of the information, or if any questions for the presenters that you've heard from today, please feel free to send us your questions via the questions feature or chat that's located on the right side of your screen. We did have one question about materials in the marketplace. If you have any questions or need help ordering materials, please feel free to email us at coverage2care@cms.hhs.gov.
And I'll add that some of the marketplace materials might not be in stock because they're being updated. So it might just be a matter of waiting a little bit longer. But if there's something in particular that you need or want, do email us, because I'll go and find out for you what's going on with that particular resource. And I just also want to highlight that our website has been updated this year, and that includes just this week, or just today actually, our new enrollment toolkit with the new numbers is on our website. And that page is go.cms.gov/C2C. And you can find all our tools on there, but if you have any problems or finding what you're needing or anything, again, you can always email us and we'll help direct you. As we give just a minute to see if any questions or any ideas about how you've used Coverage to Care or how you've been a C2C partner, we'll just give you a couple ideas of things that our past partners have done. We have one group that we know uses Coverage to Care and uses health literacy efforts a lot that works out of Chicago, and they've been working integrating pieces of prevention materials and pieces of the roadmap into work that their community group has done. So they've done particular weeks doing healthy weeks, and then talking about how you can eat healthy, and have you gotten your vaccinations or your immunizations yet? We had one pastor that told me he was using Coverage to Care in his sermons, and he talked about how he went and received a preventative service and found out that he had something that could be taken care of easily, but if he hadn't gone and received the service, he would not have found out about it. So he used that as an opportunity to teach with his congregation and to talk about making sure, for this particular instance, he talked about the body being a temple and treating it nicely. So again, that's the idea of taking a message and personalizing it for your community. Whatever your focus of your community group is, you can take healthy messages and the ideas of using your health coverage and work that to make sure that it resonates with your community. So maybe it's changing the language so that it makes sense in your local area. I heard another group in Mississippi change some of the roadmap language so that it made sense in their area. So do that. Use our blog posts, use our listservs or social media graphics, and make them your own. They're there to help you.
So we have a few questions coming through. One is, are there some materials that you mentioned that are used more than others? Conversely, are there materials that haven't been used as expected?
Sure. So the signature piece is definitely still the roadmap to better care and healthier you. That's the most popular piece that we have. We do have step booklets, which are the 8 individual steps from the roadmaps. Those are not used as much as we might have thought, but that's probably because the roadmap is inclusive of them. So the roadmap's the most popular piece. The 5 ways to make the most of your health coverage is another one. It's new, just this summer that we've gotten it out, but we've gotten some good feedback about it. It's kind of like the roadmap, but it's smaller. It's just a short front and back. So the roadmap is long. Admittedly, it is very long, and it's a lot for a consumer to take in, and it takes a lot of time to go through it with the consumer. So the 5 ways is kind of an alternative if you only have a couple seconds, or if you're at a health fair or some event where you're just briefly meeting people. The 5 ways has been one that's been pretty popular. This time of year, we always see a lot of downloads for our Enrollment Toolkit. So that'll be the case for the next couple months. So hopefully the updated numbers will help people out a lot this year.
Excellent. And I know that the presentation did include some links on your screen. I want to call to your attention that we have uploaded the presentation to a PDF handout that's included on the right side of your screen. We'll also be sending it out following this webinar with a thank you note to all of you for joining us here today. You'll be able to access that. And in the future, we'll also make the webinar available for video so that you can download it and look at it from our website. I have one question for Enroll America. How are you working with some of the folks you've engaged to be able to now transition from enrollment to coverage, and how to use that coverage for preventive services?
That's a great question. And I wish that I had folks from our field team in the room with me, because they would be the best positioned to talk about some of the ways that have been successful so far in terms of engaging partners. I will say that in addition to, I mentioned the connector tool and connecting consumers to appointments with assisters, because that's really where a lot of the action is. And we've also been doing a lot of work, excuse me, with our training partners through what we've called the Get Covered Academy, to really sort of institutionalize the whole sort of gamut of best practices that we have been using over the past 3 years to connect folks to enrollment. Sorry, something in my throat today. and health insurance literacy, and sort of ensuring consumers know what next steps are embedded in that. Unfortunately, I don't have any specific examples from communities at my fingertips right now. I wish I did.
Thank you.
Jenny, I'll just add in that a lot of our navigators and assisters are doing coverage to care work. So if you're in a community and you want to connect with somebody who might be doing that, there's a lot of partnerships that happen at the community level that we don't even know about most of them, but So maybe a church or a health group, or maybe a particular interest group like a certain population group might get in touch with navigators and assisters in their area because they can collaborate together and do a lot of this work together to help each other out. So navigators and assisters a lot of times will do coverage to care work or some sort of health literacy work. So we do see a lot of that at enrollment too.
And if you're interested in partnering and helping to educate others in your community, we would like to welcome you as a collaborator. We would ask that you also email us at coverage2care@cms.hhs.gov so that we can learn more about what you're doing in your community and also what free materials you may need to support your efforts on the ground. There is another question about why was C2C started? What was the impetus for it?
Sure. So that's the part we normally talk about, and today we just focus right on open enrollment. But Coverage to Care it launched in 2014, and the idea came up a little bit before then after the Affordable Care Act was passed. So we knew the ACA had established the marketplace and the state marketplaces, and we knew that people were going to be enrolling in insurance who either they hadn't had insurance before or maybe it had been a couple years. So the marketplaces were going to offer these people plans and coverage, but a lot of times there's still another step of, okay, now what do I do? So Coverage to Care was created and launched in 2014 to fill that need. So the idea is a person is enrolled, and that's great, but they need to know how to actually use their coverage and understand what it means. So it's kind of using what you're paying for. And so Coverage to Care was created with the 8 steps to walk a person through the comprehensive list of why it's important to have health insurance, why it's important to stay healthy, what those terms mean, and walking them through actually finding a provider, actually making that appointment, and seeing the provider. So it's an important piece that a lot of us sometimes forget. We enroll, we pay our premium, but we never actually go to the doctor unless we're not feeling well. And so Coverage to Care was created to help fill in that piece and to help make it more affordable to actually use your coverage, knowing which doctor is going to be covered by the insurance plan and which services you can receive at no cost, and knowing what the cost will be when you actually do have to pay.
I'd also add that we've heard a lot of stories of folks who are having insurance for the first time in their life and who are used to using the emergency care and ambulatory care. And so Coverage to Care is also about educating folks about the importance of prevention and some of the low-cost or free services that are available once they're covered. That said, we'd like to thank everyone for joining the webinar here today. You can contact us, as I mentioned, coverage2care@cms.hhs.gov. You can also visit us at go.cms.gov/C2C. We will have a feedback form that's going to pop up shortly, and we welcome your comments and insights. Thank you so much for joining us today.